Good morning, and it's nice to talk about male fertility. This is the month of fertility awareness, and I think in Wijnland Fertility it's very important for us to get the guys in here and that we can spend more time with them and talk about the diagnosis. Last year, I've been at the European Reproductive Society pre-conference, and I learned a lot about male fertility and the counselling of male fertility and how to give the diagnosis of the zero count. And there was only 4 things that was so important for me when I come back. I think the clinical side to do a clinical diagnosis of male fertility is quite easy, but when it comes to the emotional part, we neglected it a lot. So I'm sitting here with Dr. van Waart, and the first thing that I pick up was that when we give the diagnosis of male fertility, guys use different language to compare to women. Even the psychologists at that specific conference struggle to talk to guys about male fertility, and they also do not really understand maybe the language that guys is using. And Dr. van Waart being a patient himself, and he's treated male fertility at our clinic, and I think the first question is, how is it when you give the diagnosis to patients? Are you using different languages? Will you do it different to compare to women? Yeah, so just give us a little bit of advice on that.
I think it's a very difficult situation to be in often. So if the couple sits in front of you, I think firstly the question is whether the wife should be there or not.
Yes, that's right.
I think I prefer to have the wife there, but whether that's the right thing, I'm unsure. And then you would like to give the news to them. And very often what I do is I give them the classification of sperm, how we adjudicate it, and then you have to break the news. I think it's often if you break the news, you put yourself in that situation and you wonder what it would be like if you get that news. So then once you've broken the news, I think we talk about it. You can obviously see that it's a bit of a shock, especially on the male side, but very often you see the wife or the partner actually have a different reaction as well. I think it's fairly easy to see that they actually live into that situation, and for them it's also difficult because it also affects their future. So I think to give the diagnosis is not just giving it. I think you must give it in a sensitive way. I think you must give context. You must take into account that there are 2 people in that relationship. And then very often they would know from a practical point of view is, what should they do now? And very often they're unprepared. But if you have a good system that can prepare them, I think it can soften the blow quite significantly. And I think what is very important if you get the diagnosis is that's given on that specific episode that you pass that sample. So there are a lot of things that can impact on that. Medication can impact. It can be just only a once-off. And I think along with the diagnosis, one has to do the physical examination, and then you get a better idea of what's going on.
I think to come to that point, what I'm hearing is that guys needed more facts. They don't want the diagnosis to be softened out. They don't want so masculinity is playing there a very important role. So normally the guys don't like the woman to sit next to them because the women do overreact. Because as you said, when male fertility is in a couple, mostly the dream for a woman is that not becoming a mother, it's falling apart for her. The second thing what I learned from this specific course and helped me a lot when we sit with couple in front is that for the first time I realized that the knowledge of fertility and reproductive medicine with the guys is not there. And I specifically talk to mothers. I'm also a mother. We're not sitting down with the boys and telling them about teenage states intact as we do with the girls, and when they start shaving, we don't ask them how's it feeling and how it's been done sometimes. So it's difficult for them to talk about certain emotional things. Maybe they don't know what is the reproductive medicine at all. They don't know what's important in how the sperm has been formed and the whole 3 months process. So I think that's when it's very important when you sit down with guys. Do you experience it sometimes that it's difficult to connect with them, or?
Yes, I think it is much more difficult to connect to males as a general rule. I think mostly men are brought up to be practical and be problem solvers. I think all over cultures, it's accepted that fertility, male fertility it's a given. And I think even in the African cultures, even if there's a strong male factor, the fingers always point towards the female. Fertility is a female problem, and it's certainly not. I think in the male part, to explain the sperm parameters and the process, very often that knowledge is lacking. And I think it's important to do that. But the bottom line is that I think males probably need a practical solution to that. They need to be cared for from a psychological point of view, and that often is neglected. But just from a practical point of view, to explain to them, because it's something that's lacking in our education as boys, and I think that's something that should get attention, probably in raising of kids in future and probably now.
Yes, and the third thing that I learned from this specific course, that when the diagnosis come from males, or when they realize there's something wrong and I need to see somebody, they don't know where to go. Mostly they go to urologist and you know, and they sometimes feel that reproductive medicine or the fertility specialist neglected them. They not concentrate only as them as a patient, they mostly concentrate on women. And that was very interesting for me, because what is the discipline that really needed to know more about male fertility? Is it time to change that? I don't know how it works in South Africa. I know you see the couples always. Yeah, just comment on that.
Yes, I think if you receive the diagnosis that there's a problem on the male side, very often a knee-jerk reaction is to refer the males to a urologist. And I think it's a good thing, because there are certain pathological conditions that actually can impact on male fertility. But as fertility doctors, I think urologists very often are not properly equipped to guide them forward and to complete the diagnosis or complete the treatment, although there are some of them that are very good. So I think the first port of call once you receive that diagnosis would probably be to attend a fertility unit, where they can tell you about the reproductive outcomes and what to do about that. But certainly I think part along with that would probably be a urological consultation if indicated. But the fertility specialist very often will refer the males appropriately. So I think don't bark up the wrong tree. I think start with your fertility specialist if you want to fall pregnant, and they will guide you appropriately from there onwards.
The fourth one that I learned from this specific course was like that guys do have mental health problems as well, that they do have a higher rate of depression sometimes, and that maybe could also play a role when there is erectile problems as well, when they're in certain medications, and they don't know it when they use these kind of medications. And then also after the diagnosis of male fertility, the emotional things that, you know, they struggle. They really started to believe they less masculinity, less of a man, and they struggle with erectile problems. Suddenly, the sexual intercourse is a problem sometimes. It could be in their mind, but they do believe, you know, there's something wrong with me. And after the diagnosis or the sperm test that normally the embryologist is working with, sometimes we send them away and not taking care of them. So I think at Wijnland Fertility, and with Dylan, that's the head of andrology, we decided that we will take care of men here specific and try to open a door and a voice for them to come back and talk about these problems. And I think that's a thing that you as a doctor feel quite strongly about as well.
Yes, I think very often we think from a medical point of view, once you've made the diagnosis and you've solved the problem either by getting sperm via testis biopsy or whether the males adopt sperm, then our job is done once the pregnancy is settled. And certainly that's only the beginning, because afterwards that father or the male partner has to deal with that relationship and with a family. And that I think is very challenging, because sometimes it's not your own biological child, but it's part of your family. Otherwise, in other situations, you've gone through quite a lot to get there, And then the males do struggle with certain things like erectile dysfunction and even problems in the relationship. So I think it's critical that one should take care of that afterwards and make sure your follow-up program is good, and that a clinic or a unit where they will feel safe to talk about that and get guided in the appropriate direction. I think that's something that we feel very strongly about.
I think also here, 1 out of 2 of our marriages where the male diagnosis is coming in is ended up in a divorce. The guys started to withdraw from relationships. It's too complicated for them. They needed to work so hard on the psychological side, and then it's easier to just left and see the way somewhere else. So I think it's very important, the follow-ups and taking care of them on the emotional side.
I fully agree. I think we've seen that, unfortunately, that some relationships don't last, and it's for reasons that's probably not valid and that can be saved if it's treated appropriately. And I think that's something that we would like to see on the way forward, that we care for those couples in a way that they should be cared for.
And I think here specific at Wijnland, we want the men to be taken care of, and I think it's important that we started off a whole new attitude towards male fertility.